Hi, my name's Lucy Brogden and I'm the patron for Partners in Depression. I've been the patron for about 5 years since the project got up and running. It's a fantastic program and I'm very proud to be associated with it. My own journey and how I came to know Partners in Depression is quite long and involved, but it's a very positive outcome and it's a good story that I like to be able to share with people. It's a story of hope and encouragement. About 5 years ago, the Hunter Institute of Mental Health approached me and invited me to be the patron of Partners in Depression, and they took me through the great work that they'd done in building up the program, designing the program, the research and evidence that they'd put together in terms of the need for the program and the way they were going to put the program together. And going through all that great work that they'd done, I was immediately sold that this was going to be a fantastic initiative and that it actually was going to meet a real need in the community. I realised once they started talking me through it that I'd only wish it was there when I was at the crisis time in my life, and that maybe it would have made the journey that much easier, as I know it's made many other people's journeys that have done the program much easier. I find myself often contacted almost once or twice a week by people who are caring and loving someone with depression and looking for where do they find answers, where do they get information, how can they find help for themselves. And Partners in Depression provides all of that and more. I live with and love my husband who has depression. He's had depression for about 15 years, but he was only diagnosed about 7 years ago. Like many people that do love and care for someone with depression, we often see the signs and realise that there's something not right well before they do. And we are desperate, and I understand that desperation to try and help. You try and fix the problem. At first you're not sure if it's an illness or it's something you're doing wrong, and there's a whole cycle of information seeking, trying to understand, and then self-doubt and self-blame. And I've been there and I completely understand that position. Fortunately or unfortunately for me, John did get diagnosed, but it was in a rather tragic set of circumstances that his diagnosis came about after an attempted suicide. But once the diagnosis came, for us it's been a positive journey towards recovery. Well, recovery or a good way of living and coping. We don't say that John suffers with depression, we say that John lives with depression, and in living with depression, the family lives with depression, and we work as a team to do that. When we first came to be diagnosed with depression, because we kind of think of it in a slightly collective sense, I looked for a lot of information, I looked for ways to do the best I could to help him in his recovery and in living with depression. A lot of that information wasn't around, but that's now available through Partners in Depression programs. The great thing about the Partners in Depression program is it covers a lot of bases and provides a lot of support to people that are struggling as carers. Not even if you're struggling, it still provides great support to be the best carer that you can be, and I think that's what we all want to do. The Partners in Depression program provides information about the illness, about treatments, but most importantly it provides information on how to be a good carer, and that's through self-care. You can't care for someone properly if you're not caring for yourself, and that's really at the end of the day the lesson and the number one takeaway from the program. I think we've done a lot to overcome the stigma around mental illness, and we do talk about it a lot more openly, but still I know that there are many people that are suffering alone or in silence behind closed doors. And one of the great things that Partners in Depression brings to people is that sense that they're not alone. They can come together, realise that the experiences are similar, that the journey is not that different, and then together they can collectively support themselves on the journey. So even though they might come together for the 6-week program, often those groups choose to stay together and meet informally and support each other. Living with and loving someone with depression can be a real challenge. The journey is a roller coaster of true ups and downs. One of the key things to finding the journey off the roller coaster and moving in a positive trajectory is diagnosis. And if I could have the silver bullet for how to get people to seek help on their own, I would have made a lot of money. That is the tricky part, but the literature shows and our experience shows that diagnosis, getting someone diagnosed, is really the starting point to a really positive journey home. John's experience was very public, his crisis and crash was very public, but the silver lining in that is that he did get diagnosed, and once he was diagnosed, he took responsibility for his illness, and then together we can learn to live with the depression as a family.